Hello everyone, and welcome to this overview for and on behalf of the Renal Patient Support Group, the RPSG. My name's Shahid Mohammed. I'm an academic and scientist at Coventry, and this overview is on behalf sorry on as part of the UKKW UK Kidney Week 2025, and this presentation will be on nephrology challenges and global care, striving for scientific and nephrology excellence, a siege to bring global unity, and looking at bridging between primary and secondary healthcare sectors. So a bit of intro. So chronic kidney disease or CKD is a complex, a long-standing or long-term condition that tends to occur in all age cohorts. So though in the literature it is where there is a sort of a bias more so in amongst the adult healthcare population versus in the adult healthcare population versus those in pediatrics or young people population. Many individuals may be disadvantaged by perceptions of helplessness and feelings of powerless against a backdrop of diminished health outlook. And the all-cause mortality rate in CKD is something in on around 30 to 60 times higher than those in the general population. Patients or recipients are now being prompted more towards self-care, and this at the same time can prompt stress triggers. The epidemiology for actual CKD in the United Kingdom relates to what has been outlined in the National Institute and Care Excellence Guidelines, and also all the NICE guidelines and the KDIGO guidelines based on the KDIGO guidelines in the United States. A look at healthcare service provision then. So patients or recipients want more understanding of health or healthcare in a range and across areas, and also at the same time have a sense of requirement for different healthcare professionals to be part of discussions or healthcare aspects where they can get a more informed understanding. In line to this, social media has a basis, and in the context of healthcare service, it can be identified as an essential tool wherein both healthcare service users and providers identify information, evidence, and practice surrounding health and disease. At the same time, however, what is yet to be investigated or understood is healthcare service provision through the use of social media linked to e-health or e-learning, wherein patients and professionals co-develop online learning to integrate between online and sort of the traditional consultation spaces. So a little bit now going into the RPSG. So the RPSG, or the Renal Patient Support Group was founded and co-founded, founded and co-founded in around 2009, and it was where three individuals primarily identified that in the traditional consultation spaces, patients and or carers, for example, didn't have for example enough time, or felt that they didn't have enough time to ask some of those important or pertinent additional questions as part of their healthcare plans. And so the individuals at the time then thought to pilot a sort of an online space through primarily social media, and that social media being through Facebook group, Facebook, and a Facebook group was initialized in around, or founded in around 2009, and the basis of the RPSG was primarily where patients and carers could share lived experiences, but also where through those lived experiences could learn and understand learn and understand from, for example, in context of what sort of in context of how different healthcare different healthcare and sort of scenarios or shared lived experiences, how they might differ, and for example, and also where if where examples of different healthcare could be learned, and then at that same time those different healthcare aspects could then be shared through their consultations, or through their healthcare consultations. And so it was then, as the RPSG sort of developed and then it progressed, a website had been initiated which factored all of the aspects that were primarily on the Facebook page, but then through the Facebook page, a lot of the aspects had then gone into the developing or initializing of the website space, and the website space itself in around the RPSG has, for example, webinars, audios, and podcasts. Has overviews in around different aspects of healthcare, different aspects of kidney care, and also more recently, one of the aspects in around the website has been an RPSG biobank page, which actually is a page where we invite where there's invitation and call to different kinds of healthcare professionals and researchers who can who have who basically talk a little bit in around the research that they're doing, and where it offers a sort of a space where other researchers, patients and carers, for example, can click in onto that page and to find out in around different aspects of kidney care, but also where the biobank page is for where researchers, if they have a project or works in around kidney care that they want to see sort of patient involvement in, they can actually do a short video, and they can have that posted onto the biobank page, so that in a way to increase potentially participation through the RPSG platform. The RPSG platform RPSG also collaborates with the pediatrics and young people equivalent, and together the two social media platforms have in around about 12,000 healthcare service users and carers, and between the two social media platforms there are some healthcare professionals as well. So this then leads into some data that I like to share with everyone, and this is some data from the last 60 days, the last 2 months, in around the last 2 months, of in around the RPSG, and primarily the RPSG and not KDARS, the pediatric or young people equivalent social media platform. So here on this page, I look at sort of the sort of age and gender age and gender representation, and aligned to also those from female backgrounds, those from male backgrounds, and those from other backgrounds, or those who are preferred not to say. So in this page, you can see that the most at the moment, or at least in the last 60 days, if not longer, for example, the most most representation in on the RPSG is of those from female backgrounds, in the age range of 45 to 50, 45 to 54 years of age, and then in around the male, in around the male background, it is where the highest representation is between those from male backgrounds being of the age range 35 to 44 years of age, and at the same time, where other is concerned, there the data around other is where there's where healthcare users has set have in around anything up to eight different people or healthcare service users, and so the data in around other is not really is not really it cannot really be seen on the on this slide, but you can see that the data is in the graph to some extent. So then looking at the next page, where looking at the RPSG membership and sort of the daily members over the last 60 days. And you can see in between April and May, there have been an increase from an increase in around the numbers, and you can see the total at the top is at the moment showing 10,000 around 10,216 or 10,218 as a total, and what we see here is that there have been a couple of popular days in when for example when the number of healthcare users had been on the RPSG platform, in on the RPSG platform in April and in May, and you can see a few of the highest the highest points in April and in May. But generally, you can see that the number of a number of daily numbers, for example, has increased, and then sort of steadied over the last 2 months or 60 days. And then looking at a page here on the last 60 days in context of healthcare service users and carers, etc., by cities. So in as part of cities, you can see that for example, London, UK have the highest number of users, healthcare service users in on the RPSG, and then secondly, there is a sort of a high number of healthcare service users from North Africa. And then there's a high representation or high numbers in from New York in the United States, and then you can see sort of a steady number of healthcare service users across different cities, in across different across different countries as well, in different countries as well. Obviously, this is at the same time, this is data just from the last 2 months or 60 days, and so it is where you can't see, for example, this graph does not show, or the data does not show all the way up to 10,000 members on this graph, but it does show in around up to a number of healthcare service users per city, and then going into and then moving into this page, looking at the RPSG membership in the last 60 days, and by the memberships from membership, looking at membership of those healthcare service users and carers for example, and then looking at that against different countries, and for example, you can see, for example, the sort of a trend where there's been an increase in across different an increase of membership in across different countries, but then as that also increases, there's been sort of an increase and sort of a steady sort of membership over across different countries, and across the bottom here, highlighting sort of the different countries. Not all, for example, not all of the countries, not all countries are or can be seen here, in as part of the as part of the horizontal axis, but we can see that the highest number of healthcare service users are actually currently from the United States. We have just over 3,200, or just under 3,300 healthcare service users and carers from the United States, as members, sort of utilizing the RPSG platform. And then secondly, we have the second highest healthcare service users and members are from the United Kingdom. In around 3,000, just over 3,000 healthcare service users. And then you can see that there is an increase, use by healthcare service users and members, being from India, being around 380 or 379, and then there are members from other countries in on this. In the beginning, when the RPSG was initiated or conceptualized, the highest number of healthcare service users were primarily from the United Kingdom. But as the RPSG has grown over the last sort of durations, over the last sort of decade, or decade durations or so, there's been an increase from healthcare service users and carers from the United States, etc. And so, looking into the next page, we see that. So the question in that, one of the questions that can be supposed, and what does the data sort of represent, at least in how the RPSG, in around the RPSG sort of trajectory, if you will. So this where then there is since healthcare service users and carers, for example, often find that they don't have as much time in sort of traditional consultation sort of environs, or clinical consultation environs, then this is where, for example, where the RPSG platform, or through the RPSG, or through a link in line to the use of social media, for example, it is where there's opportunity to sort of bridge aligned to sort of educational or sort of kidney educational e-health or e-health learning, or e-health clinics. And so, although healthcare service users have improved through the use, healthcare services have improved through the use of ICT, the use of the World Wide Web, or the internet, and through devices and through healthcare apps. This has not sort of interlinked directly into electronic patient records, unfortunately. So healthcare service users and healthcare providers also have differences in the use of terminologies and health literacies. Thus, there can still be a sense of disconnect. a sense of disconnect. So the idea would be that one of the bases is that a more inclusive MDT, a multidisciplinary team through patient-centric organizations and or healthcare services, including the use of social media, can help. So, following in from the previous slide, where I talked about sort of the opportunities for kidney or nephrology based healthcare education through the use of social media, for example. Um, through the use of social media and through a basis of multidisciplinary team or MDT, e-health learning or e-health clinics, for example. This page here sort of shows, for example, the number of requests that there have been on the RPSG platform between in again from the last 60 days or the last 2 months, and we can see from here there's been sort of a bit sort of an increase in the in early April. In early April, then there was a sort of a decrease, and then there's been a sort of an increase in mid-April, and it steadied along until the end of April. Then there was a decrease in towards the end of April, and then sort of an increase in the in early in around the early in around early May, and then sort of steadied along between sort of mid-May or early May up until the end of May. And so where it says where this is a sort of a screenshot, if you will, from the RPSG page, and it says here that there were 47 around 47 membership requests in that last 2 months or in the last 2 months or last 60 days. Now, what this represents or sort of shows, at least in some contexts, is that there is a requirement, almost a requirement for healthcare professionals and patients to co-develop educational themes based on aspects pertaining to kidney care, so that patients can actually have or gain sort of attain understanding and around aspects pertaining to their healthcare in through the RPSG platform. And the idea or the basis is around this is again would be to see a sort of a bridging between primary care and secondary care healthcare sectors. That healthcare service users and carers can see can initially also see a way to have particular answers to important questions around kidney care or around their healthcare, but also where healthcare professionals can see a sense of where they can share knowledge and provide and offer knowledge to healthcare service users through the RPSG space. And so by just again where there's been increase there's been, for example, around 47 membership requests on in the last 2 months, for example. It sort of shows that externally in sort of traditional environs, to traditional consultation environs, and between healthcare sectors, that there has been no sort of better time to see that social media and healthcare professionals and patients actually work in such a way that there is a joined up thinking. So on this page, this looks at the RPSG total membership in around the last 2 months. And as in one of the previous slides, looking at the number of healthcare service users looking at sort of healthcare service users over over the last 2 months in and around for example, the cities and the countries, for example, but also the number of members that have requested to join the RPSG. For example, we can see here there has been the total number of RPSG members today are in around just over 10,200 total members, and you can see sort of the highest increased in up to towards the end of April 2025, and then the numbers sort of steady along in up to 2020 in around from early May up to the end of May 2025. And so I thought to share this slide or this page because again it shows even in this in sort of in 2025, there's still being an increase in the RPSG in approach to the RPSG, and again where the number of healthcare service users is equivalent, if you will, to a busy general practitioner, or primary care, or a general practitioner surgery, or a GP surgery on any given day. So healthcare service users are sharing apart from lived experiences, they are also sharing clinical information, because they get to learn some of the terminologies, even though there are differences in the way terminologies are used. For example, they get to learn through the RPSG platform, but they also use terminologies that are synonymous, if you will, aligned to primary care physicians, and also their clinical teams are in amongst secondary healthcare sectors in as part of in the division of nephrology or kidney care. So patients and carers are using or utilizing the RPSG, and have been over and close to 2 decades, near 2 decades, and the numbers have sort of have steadied along. But again, there is a real opportunity, because where there should be a sort of more bridging of sort of educational services, so thus patients and carers can navigate different aspects of healthcare better, then the RPSG platform can and should also allow that for and by seeing healthcare professionals and patients sort of working together, aligned to the NIHR and the National Institute of Healthcare Research involved guidelines that were published originally from 2014, which the guideline being based in around patient and public involvement on PPI. So on this page, just a quick look at RPSG and KDAR's social media. Now, this slide, or this page, or the tabulated context here was sort of adapted from a previous research poster presentation that was presented in 2023, and also a part of a sort of where some of the where some of the where the tabulated data had been from a paper published in 2018. So this page looks at social media and opportunities for healthcare sharing, and in context of the RPSG and KDOS social media platform. So here it highlights sort of the different social media platforms that that the social media the social media links that both RPSG that both social media platforms are streaming across. So for example, we have here in around, for example, Facebook. Both RPSG and KDOS have their individual social media Facebook pages. On KDOS, there's near 3,000 users or healthcare service users, carers internationally since it was initiated in 2014, and on the RPSG, as just over 10,000 healthcare service users internationally since 2009, or have been since or sort of growing since around 2009. In around Twitter or X, there has been over 2,300 tweets representing nephrology or kidney care and healthcare since 2018. The Twitter page had actually just over 2,800 previously sort of tweets and sort of postings on the Twitter page. However, it was where the RPSG the page had actually had to be revamped, owing to some issues in around the particular page at the time, and then in around the link the link around a ResearchGate, which is as some might be aware, is a link where academics and researchers can share different kinds of works, and both RPSG and KDOS have a ResearchGate page. So there are two ResearchGate pages. On KDOS, there are over 60 research items or publications in different formats surrounding pediatrics and young people. And on the RPSG, there are over 300 research items and publications surrounding science and nephrology. On Instagram, there's one Instagram page. There is one main Instagram page under the RPSG, and there's over 1,200 images and posts, and over 70 video posts surrounding or representing nephrology and healthcare since 2012. YouTube, there is two YouTube channels. One YouTube channel which has over 80 educational videos, healthcare educational videos, and one times channel that has over 20 audios and podcasts representing nephrology and healthcare since 2019. The YouTube channels are both and primarily RPSG YouTube channels. The TikTok, there was a TikTok page which was initiated sort of in the last year. In around 2024, as one TikTok page channel that has over 30 educational overviews of different sorts of presentations, and sort of poster works in around nephrology and healthcare, around nephrology, both pediatrics, young people, and and around adult kidney care. And there is a SoundCloud channel which has over 70 audios and podcasts representing nephrology in healthcare since in around 2023. There is also a blogspot and blogger which was originally initiated for example non Facebook users, for example, and where the blogspot or the blogger is sort of a page which is where for example RPSG and KDAR activities are journalized, and so there are over 200 journal posts representing nephrology in healthcare since in around 2012, and recent statistics around the blogspot or blogger has informed that there's been over 16,000 all-time views, and then there's the website, the RPSG website, which is primarily where both RPSG and KDAR's sort of media, KDAR's sort of RPSG and KDAR's sort of social media links can be accessed through where both social media for RPSG and KDAR's links are sort of based, and also where the RPSG website also has other important some other pages which are accessible to the public to find out more about different aspects of kidney care and kidney care services, kidney care services, and ultimately the social media platforms offer sort of opportunities for collaboration, but also as a way to inform to inform or highlight to healthcare professionals and to sort of academics and researchers and patients, for patients and carers in around the workings, some of the workings around the social media platforms over the last sort of few the last few decades or so. So in conclusion, the RPSGE has been the first international platform that has offered an online space for patients and carers and also healthcare professionals to prompt involvement and to link between primary and secondary healthcare sectors. Having access to healthcare through online spaces should encourage patients to feel more included, thus increasing practical understanding of renal aspects around renal care or renal disease ailments, and also in around treatments and overcoming healthcare service barriers. The RPSG platform has been the first to bridge at the same time scientific and nephrology excellence to bring global unity using social media. In summary, the aim should be ultimately to equip high healthcare service users and providers with knowledge base, and to ensure healthcare excellence is envisaged between primary and secondary healthcare sectors, and at the same time, this would also reduce inequality, increase literacy and language, and improve overall population health. And also, education service provision can be linked and integrated between social media platforms, online and through e-learning or e-health to integrate with electronic patient records. Some references. So there's one of the original papers One of the original papers that I would like to refer is a publication from 2014, looking at the sort of the initial works around the RPSG. It was a literature review published again in around 2014, and the use of around kidney care, aspects of kidney care, and the use of social media, and was published in the Journal of Renal Care, JORC, and then the publication in more recently published in around November December last year in 2024, looking at understanding education for healthcare service users aligned to social media platforms. And in that particular paper is some quantitative data looking at different educational kidney educational themes, kidney educational themes that could be co-developed, and wherein patients and professionals can co-develop different e-health or e-learning modules the for patients and carers, and where sort of e-health or e-learning sort of a service through the RPSG platform can be linked into electronic patient records or EPRs. So finally, just some dedications and some dedications. So some dedications are listed here. I won't read them. But some dedications in regards to teachers and mentors, and also some dedications as in those who have inspired in around this. So in around this particular work, and around the works around the RPSG, and in around the RPSG, and sort of some of the sort of early inspirers, and sort of mentors around sort of additional mentors, and that had done a lot of work in a time before the RPSG had been conceptualized or initialized. So thank you for listening in on this overview. To find out more about the RPSG, you can check out the website www.rpsg.org.uk, and if you check out the website, you can find out a bit more about the different aspects of the RPSG, and the different, and where the RPSG is on across different social media as well. Thank you.